Hello, I am Dr. Richa Gangwar, Senior Consultant and Director, Obstetrics and Gynecology at Cloudnine Hospital, Gomti, Nagar, Lucknow. As part of your antenatal care, we offer several blood and urine tests. These tests are done to make sure that your pregnancy is safe and to pick up any medical problems that can cause complications for you and your baby. Some of these tests are offered to everyone, while others are offered only if you are at risk of a particular condition. The tests routinely offered in the antenatal profile include: number 1, your blood group. This is usually offered at the first antenatal visit and it is done to know your blood type, whether type A or type B, and the presence or absence of the Rh factor. Now, if you are Rh negative, your body may produce antibodies that can attack your baby's red blood cells and destroy them. This can lead to anemia and jaundice in the baby. To prevent the formation of these antibodies, sometimes you are given an injection during pregnancy. Number 2, you are offered a complete blood count. This blood test counts the number of different types of cells in your blood. The number of red blood cells indicates the presence of anemia. The number of white blood cells presence of any infection, while the platelet count shows if you have any problems with the blood clotting. Thirdly, you are offered a urine test. The urine test looks for the presence of certain things in the urine. The presence of RBCs in the urine indicates some type of kidney disease or an infection. The presence of wbcs indicates again the presence of a urinary tract infection. Glucose, if present in the urine, may show that you have diabetes, and protein, if present in the urine, indicates the presence of again urinary tract infection, but sometimes it may also be due to some kidney disease or a condition known as preeclampsia, which is a serious complication caused by high blood pressure later in pregnancy. Fourthly, you are offered a glucose tolerance test. This test is done. In this test, you are given 75 grams of glucose and your blood sugar is measured for after about 2 hours. This test is routinely offered at around 24 to 28 weeks of pregnancy, but if you are at high risk of diabetes, like if you had diabetes in your previous pregnancy or some of your family member is having diabetes, you may be offered this test at an earlier date. Fifth, you are screened for the presence of rubella IgG antibodies. These antibodies indicate whether you are immune to rubella or you are not. So if you have had this rubella infection earlier or if you are vaccinated against rubella, the test will show the presence of antibodies indicating that you are immune to the disease. But if you don't have these antibodies, that you can catch this infection while pregnant and pass it on to your baby, and which may lead to complications in the baby like birth defects. So if you are not immune, you are needed to avoid any person who has the symptoms of this disease while you are pregnant. You are also offered screening for other infections like HIV, hepatitis and syphilis via blood tests. And sometimes we may also measure your vitamin D levels and your thyroid levels to rule out hypo or hypothyroidism, which may cause complications during pregnancy.